Well, good morning, everybody. Let's get ready to start. I'm very excited to see all the classrooms that we have. I see Miss Stefina's class, Miss Molina's, Miss Zambrano, and as always, Mr. Cantu's class. And I have a class that just says users, but hi, you guys. We're happy to see you. Happy Dia de los Muertos. Today's November 2nd. We are very excited to have 6 nurses with us who are going to share their stories so that you can see all the different fields of nursing there are available. And this is just a handful. You know, when we talk about the medical field, we talk about doctors and nurses, but there's so much more available. And we hope to bring some of that to you. So we're going to start with 2 University of Texas and Rio Grande Valley nurses. And the first one we're going to talk to is Pam Sullivan. So Pam, let me make sure I have you unmuted, or I think you have to unmute yourself. And we want to welcome you.
Good morning. Am I unmuted?
I can hear you just fine, thank you.
Okay, can you see me okay?
We can see you great.
Good morning, everybody. My name is Pam Sullivan, and I'm an assistant professor of nursing at the University of Texas, Rio Grande Valley, here in Edinburgh, Texas. And I'm also a nurse practitioner, which means that after I became a registered nurse, I went back to school for more advanced education and became a nurse practitioner. So now I teach nursing at the university. And I want to thank you for inviting me to this mentoring session. Generally, I don't spend a lot of time talking about myself, but I do like to talk about the profession of nursing and choosing a career in nursing. So thank you for inviting me. And I hope my story has some value for you. I was an average high school student. I made average grades. My behavior was average. I did, however, participate in a club. And the club was called at that time the Future Nurses of America. And the point of the club was for students that were interested in thinking about nursing as a career. So we would get together and we would go to area nursing homes and spend time with the residents with this club while I was in high school. So one afternoon I was at the nursing home like I was supposed to be, and I was charged with feeding an elderly lady her supper. So I went to the room and I introduced myself, and I looked above the bed and there was a sign and it just said blind. I looked in the bed and there was an elderly, fragile looking woman. In fact, she looked like a skeleton with wild white hair. I can still see her today. So I went in the room and I prepared to feed her, and she wasn't interested. She said, "I don't want that. I want an apple. I want a nice, crisp apple." Okay, so I ran down to the kitchen in the facility, and they gave me applesauce, and I took it back to this lady. And so at this point, she started yelling and pleading and almost begging. "I just want an apple. Can't you get me an apple?" So I ran back down to the kitchen, and the kitchen staff looked at me like I was crazy. They said, "She can't have an apple. She has no teeth. How's she going to bite and chew an apple? She can't have an apple." So I went back to the room and stayed like I was supposed to. I never could comfort her. She begged and cried for an apple. And you know, since that day, I have thought so many times, what could I have done differently? Why didn't I go get an apple and let her hold it? Why didn't I go get an apple and let her put it up to her mouth? What else could have been done? Well, I graduated high school and went to college. I got into nursing school, and it was hard. Remember, I was an average student. I think in nursing school, though, my saving grace was y'all might not want to hear this, I read every assignment that was assigned in my text. And I know you have e-text. It's the same thing. So I worked my way through nursing school, and 5 short years later, I graduated, and I took the national exam, and I became a registered nurse. Now the exam if you pursue this career, will be called the NCLEX RN that you'll take. So I became a registered nurse, and I started my career in hospital nursing. I was on a general medical surgical floor, and I learned a lot those first years. And one thing that I did is I said yes to every opportunity that my manager offered me. If they said we need a volunteer, my hand was up, even when I didn't fully understand what I was volunteering for. So my early years in my career, I was volunteering, I was saying yes, I was becoming an expert medical surgical nurse and an expert critical care nurse. And I don't think I was seen as so average anymore. I began to get positions like charge nurse and nursing supervisor and manager of the unit. And so I really found my career in hospital nursing very rewarding. However, you have to realize there are sacrifices as well. And I think we're going to get to some DHR nurses and they'll tell you more about it. But for many years, I worked on Christmas. I worked on Thanksgiving. I worked on Easter. I worked on my children's birthdays. In fact, my children, this is not a unique story to me, but they became accustomed to always celebrating a holiday on a different day than their friends because I was at work on Christmas Day. So I found it very rewarding, learned a lot. But at some point, about 12 years into my career, I desired more knowledge. So I returned to school and received a master's and became, which allowed me to become faculty at the university, the master's level education. I could teach nursing at the university level. And it also allowed me to become a nurse practitioner. So that's when I became the nurse practitioner and also began teaching in the university level. So now I enjoy teaching the future nurses. And I guess I just want to say to you that say yes to opportunities. Here's the mentoring part. Say yes to opportunities when they come along. Don't let fear or doubts about what all's involved hold you back. Join those high school clubs that can expose you to learning about careers and opportunities that you might want to take advantage of. Oh, you'll love this one. Read all your assigned chapters in that e-text. And lastly, I want to say, safety is first, and rules do need to be followed. But figure out a way to get her that apple.
Thank you, Pam. We appreciate your story and your entrance into the nursing field. We love to hear your stories and what nursing has done for you. So thank you very much. The next nurse that we're going to hear from has a little bit different story, and she's with the University of Texas at Rio Grande Valley also. And she's Betty John. So Betty, why don't you join us and share your story?
Hi, welcome all of you. I see a lot of young smiling faces out there. Are you really interested for coming for nursing? Mine is, I would say that my story is kind of similar to Pam, because I think when we nurses talk, our stories are kind of, similar, because that's how we find our calling. But I just want to add that my calling is, probably you might have heard Mother Teresa said there is a calling within a calling. And my story is something like that. I found mental health nursing. I'm a psychiatric mental health nurse, even though I'm not really practicing as a clinical, in the clinical area, but right now I'm teaching. I'm a clinical assistant professor at UTRGV, as Ms. Claudia said. So what happened in my life, it's a little different. When I was very little, when I was in elementary school, I used to get some throat infections, and I used to get my little IM injections for antibiotics, so I had to go to this hospital because I studied in a Catholic school and the hospital was near to that. And then when I go there, I really see these smart nurses, like especially the nun sisters and the nurses, and then I used to just look at them, I'm like, oh my God, I want to be one of them. This was when I was in my elementary school. I forgot about my pains, about the injection. I just looking at them, how amazing they are, so that's where probably my little nursing, that thing came out, but I never looked at the doctor in front of them. I looked at the nurses, the way they smile, the way they make me happy, they forget about my pain, about the injection. So that's what actually, that's what I would say that was my first thing that, think about it. I really, I'm so glad that I found my calling. After 30 years, I'm a nurse for 30 years, but now when I look back, it's so rewarding, that's what I wanted to do in my life. Again, my school, it was okay. I'm kind of I would say that I was a good student. So according to my parents, they wanted me to try the medical field too. So I did really try, but my calling was not there. I knew that. So I just gave my entrance exam, that's it. But after that, I didn't have any plan to get in also, but I wanted to be like in the nursing field. So I did my bachelor's back then, 85, yeah. So I did, I'm graduated from India, both from my bachelor's as well as master's. So I need to go back to, back then, when I entered into my nursing school in India. So, well, it was really tough. As Pam said, nursing school is not easy. It is easy to get in. I mean, not easy to get in like these days, but, but once all your effort is to get in. Once you get in there, you still need to pass the score. You have to write your exams and all those things. But anyway, when I was doing my clinical rotations in my mental health nursing, I was actually, that was something like changed my life. I was sitting, my professor, I would say that she was my role model. And I was really amazed by the way she was taking care of those mental patients. Back then, we didn't have any like medications or, like we have right now when I see in mental health field now. So these patients with chronic schizophrenia, I know some of you probably do not know those terms now, but, paranoid schizophrenia, catatonic schizophrenic patients, it's really hard to take care of them. And, especially with the paranoid, that one paranoid schizophrenic patient changed I would say that my calling. Like I was sitting next to him for almost 6 hours, not talking, nothing, just sitting there, just, let him know that I'm here for you. That's all my instructor told me to tell him. I didn't know what I was stepping into, but I knew that, that's something really, that's what I need to do. So I sat there all my clinical hour, just made sure that, he didn't talk to me. But I know that by the end of the time we finished the clinical rotation there, I was able to talk to him. He was actually communicating with me. So it was where we had, I remember like we had about 4 weeks of rotations that time. So we had, it was a little different. We had everyday clinicals and, so we had 4 weeks. By the time I was able to interact with the client, not a lot, but, a little bit. So there was a lot of stories, for mental health clinical rotation. So that's when I decided whenever I'm going to do my master's, I'm going to do insight because I really want to make a change in my patient's life. Not many patients, they like mental health nursing because to me, mental health that's for everybody. We all need mental health. If somebody is sad, whom they need to talk, whom they have to talk to, they have to talk to someone. If there is nobody around, it is really, I feel that it's really sad. So I want to be that person, if anybody want to talk to, if anybody want to come by, you have any problems, like I want to be that person, that's why I can at least help someone out there. So that's how actually, I went to do my nursing, mental health nursing, I would say. And I practiced, I was in India, then I moved to States about, I think, 14 years ago, and they started working. But my initial years, I worked everywhere. As Pam said, I worked surgical unit, med-surg, CCU, like, coronary care unit, and different specializations. And I worked in many clinics. As a clinic nurse, I worked in infectious clinic nurse. That was my really, I really felt that all this, I had many HIV patients there. different kinds of patients, and you need to be with them, one of them, like, to know them and to be with them, that was like very rewarding. And then of course, then I worked as a different areas. I worked as a case manager. I would say that, as Pam said, any opportunity came by, I always said yes. Right now, this opportunity, somebody asked me, can you talk? I said yes. So I'm here right now. So any opportunity that's nurses, because you never know where you are going to help that person, or where, how you are going to be used by, because I believe that I have a purpose. I'm here because of a purpose. So I want to fulfill that purpose. And I think that's my goal every day, every morning, that's my goal. And I really looking for this, the young students who are interested in nursing. I really want to encourage them, telling them that, this is very rewarding field. Again, I need to let you know that this is not a cup of everybody's tea, but once, if you have a calling in there, you should do anything and everything that you need to get in there. And, be that person, to make a change in anybody who are you, going to meet with. A nurse is always a nurse, not only in the hospital bed, at home, in your workplace, in Walmart, in anywhere you go, in HEB, anybody you see a smile, that's a nurse. You forget about yourself when you see somebody, when you, and that's nursing is. And, I really want to give that message this morning to you guys who are listening to me out there. So find your call, what it is, and, go after it, get it, and be there. Thank you. I think that's all I have to say. I don't know, I jumped all around, but, I just wanted to say my story. That's it.
Thank you very much. We appreciate that. I want to remind the students in the classroom that we have the chat feature that you can go to over on the side of the screen, and you can put any questions you have for our nurses, or you can just unmute and ask the question directly. So I'm going to wait for just a minute here and to see if there are any students who have questions for Pam or Betty.
Yeah, we need more questions.
Nobody? Okay, if you come up with any questions, please feel free to type them into the chat feature, or just unmute and ask the questions. Oh, I think we have a question.
Yes, we have a question.
Great.
I want to say, you could just type it. What is the HESI exam?
The HESI. The HESI.
Oh, what does HESI, HESI stand for?
Go, Betty.
It is actually
That's a national exam.
Yeah, it is a standardized exam. Actually, that is actually for the entrance exam for the nursing, for nursing students. That's what I would say.
It's a high stakes standardized exam that we use prior to people coming into our program, and we also use a similar exam to exit our program.
So it's like an entrance exam for a nursing program, and it covers things that you would generally learn in school: reading, writing, mathematics, but it also includes human anatomy and some biology.
Yes.
Do you have any other questions? That was a good one. Thank you very much.
Yes, and let me just say there that exam, I think it has 5 sections to it.
Yes, it does.
Yes. Thank you. Good question.
And then just to let you know that there's an exam that you take to be licensed, and that's called the NCLEX exam.
Another question.
Good morning. Oh, I'm sorry. I just want to do a follow-up on that question and ask everybody, what is the best way that students who are in high school can prepare for the HESI exam?
They have actually the resources available from the company's website. This exam is actually provided, by Elsevier company, and they do have actually some books available and then practice exams available, and they can get that. And also, basically, the anatomy and physiology, the general biology, math, reading, English comprehension, vocabulary, grammar, all these are, they're already actually, studying it. But to prepare particularly for that exam, they can actually avail those books as well as, they can get those practice exams. They have to prepare for it, but they can get those.
Reading math,
Human anatomy and biology.
Okay. Are there any other questions? It doesn't look like it. So
There's questions on the chat, Claudia, just to let you know.
Oh, there are. Oh, okay. I didn't see one there. Yes, the HESI stands for Health Education Systems Incorporated. Oh, Sela Garcia from La Jolla says, what are some challenges you face during your nursing program?
Good question, though. As an instructor, as a teacher, as an instructor, also as a student. Both
I think everything.
As students we face, once they really want to come in, and the students are, they put all their effort to come in, and once they come in, the time management as well as, the material they have to study, they find it really hard, because and up to 12th or, college, high school, it is very different. We have more critical thinking, like putting it together into one piece, that kind of study, and the students, they struggle in that. I am not saying that everybody, but that is, that is what actually we see. And then the students, they kind of lose their heart. No, I don't want to do nursing, so they kind of, get out of the program, even though they come at 4.0 GPA, but some days we see these students, they are struggling in those areas. You don't have nursing school, you don't have any time for any other distractions. It's only school. For 2 years, there is no school, there is no time for anything. So you need to put all your heart and soul into it, that this is what my aim is, this is what my goal, and I need to do that. That's actually, that's the main challenge we see. It is the study part, time management and, getting everything together, mainly time management and the study part.
The other question is, what are the 5 sections of the HESI? And I know that one. It's the math, the reading comprehension, the vocabulary, and then grammar and anatomy and physiology. So those are the sections that you would take when you take the HESI.
That's, again, of course, different schools. I know that we have, Texas A&M here also, and STC. We have different, requirements. So different schools, they take different sections. So they have even critical thinking. They have, there's a learner profile, and there's, other areas too.
Yes.
So each school has different sections. So they need to look into what the actual particular school needs, and they have to go by that.
That's correct. Thank you very much. We're going to move on and start talking to our nurses from Texas A&M. And the first nurse we're going to talk to is Yvonne Garcia. So Yvonne, the floor is yours.
Hi, good morning, everybody. So about my nursing career, when I went to nursing school, I already had 2 children at the time, and I was working a full-time job when I decided to go back to school. So I had a little bit of challenges when it came back to going to school. I went back to school my 2nd year of nursing school. I did my associates of nursing first, and my 2nd year I got a job at Mission Hospital. I'm originally from the Valley, so hi to all my Valley people. So I went and started working at Mission Hospital as a nurse technician in the emergency room. Fell in love with the emergency room. I think what I love most about the emergency room is the variety of patients that come through the door. You never know what's going to come in. You have to be ready to react to whatever problem that patient is having. So I just fell in love with the ER. Once I finished nursing school, I stayed at Mission because of that reason, that I was already familiar with that emergency room and I loved all the people there. About 5 years into my career as an ER nurse, I was noticing that there was, I am a forensic nurse, by the way. I started noticing that there would be victims that would come in for sexual assault or domestic violence, and there's a special exam that they should get. Well, there were no nurses available who were trained to do those exams in our area. So literally the patients were sometimes told, you know, you need to go home, there's nobody available, come back in the morning, but don't shower, don't eat or drink anything. So I just felt like that's just not okay. So I took it upon myself to ask my director at the time to please let me get training in that area, and start something there at the hospital to where we would have something available for these specific population of patients. So she agreed, and I went to Lubbock, San Antonio, Houston, Corpus to do training for about a year, and visited the programs that were already working with these special populations so that I could bring something back to the Valley that was, you know, a good working, functioning program for victims of violence. So a year later, in 2009, I started the first forensic program in the Valley, which was at Mission Hospital, and it was called A Safe Place. I did 24/7 call for 4 years by myself, just so that the program would get rolling. That was very difficult. I know I heard one of the other nurses earlier say that she had to put her kids aside. Well, I had to do the same in a lot of instances, because we could be out at a birthday party, we could be out at the movies, and I'd get a call that a patient was there, so I had to respond to the hospital. And that went on for 4 years. Finally, at 4 years, I was able to get one more nurse full-time, so she started to help me. Although our training is very different, she wasn't really ready to see patients alone until about a year later. So that's another year of me being 24/7. So after a while, I finally was able to have a little bit of time off. The program was running for about 2009, from 2009 to 2017. In 2017, Mission had some financial problems, and they decided to close the whole program down, which was heartbreaking for me because I felt like, where are these patients going to go now? We were seeing patients from Laredo all the way to Mercedes. So we had a big load of when it came to sexual assault patients. Luckily, Doctors Hospital at the time was ready to start something. So when our program closed down, I went straight to them and got it going within a week and started a new program there at Doctors Hospital in February 2017. And that one was called A Safe Haven. So once there, I was able to train 3 more nurses. So we were up to 4 nurses. And then I decided to finish my bachelor's. So I came to Texas A&M through an online bachelor's RN to BSN program. Finished my bachelor's somehow between all that call. And then once I finished my bachelor's, I got the opportunity. They offered me a job here at Texas A&M to help train more forensic nurses throughout the state of Texas. So obviously I jumped on that. It was hard to leave the Valley because of the program, and I really enjoy helping these patients. But I felt that this was a bigger opportunity to help train a lot more nurses across the whole state of Texas. And when it comes to forensic nurses, there's a big shortage of forensic nurses. Like right now, like I said, in the Valley, we're barely up to 4 nurses. Well, now they're left with 2 because I left and the other one quit also. So we're not there. It's not an easy job. Nurses don't really stay too long in this job. So that's what we're working on now at Texas A&M College of Nursing, is to figure out how we can help these programs to retain the nurses and be a mentor and keep them growing in the field instead of losing their nurses. So I'm here now in College Station, Bryan, Texas. Love it. I miss the Valley, but I won't go back because I see the bigger need, and I want to really help train more nurses in this area.
I think that's awesome. Thank you. Students, if you have any questions regarding forensic nursing, please put it over in the chat. Yvonne, I want to thank you for sharing your story. I think it's very interesting, and especially to see the mobility of nurses. So thank you.
Thank you.
Our next nurse that we're going to talk to is Allison Pittman, and Allison is also at Texas A&M in College Station. So Allison.
Yeah, can you all hear me okay?
We can hear you
Okay,
fine.
great. So thank you everybody for being here. I am a pediatric nurse, and to tell you a little bit about my journey, if you don't really know what you want to do in the field, that's okay, because neither did I for a long time. I thought I wanted to be a dietitian, and I got a bachelor's degree from A&M that I wouldn't have been able to get without a scholarship. So please know that if you're worried about finding the money to go to college, there are lots and lots of scholarships out there. If you do well in school, there are a lot of opportunities, and so I'm very thankful that I had financial aid that helped me to go to school. I got a degree in nutrition, and I was going to be a dietitian, and I realized as I was doing my internship that I was much more interested in what the nurses were doing than what a dietitian does. Although I love nutrition, I wanted a little bit more of a holistic, treat the whole person type of approach. So I decided to go back to school again. And I went to nursing school in Austin at the University of Texas. And I became a nurse in 1997. And one of the big things that I want to make sure that everybody knows is there seems to be kind of an old myth that you have to do your time and do adult med-surg nursing before you can go into a different field of what you really want to do. And I actually have a poster. I don't know if everybody can see it, but it's an old myth that you don't have to do adult med-surg. See, can everybody see it? It's not true. I did it 20 years ago, and you can certainly do it now. If there's something that you really want to do in nursing, and for example, pediatrics, mental health, forensic nursing, OB, deliver babies, whatever it is, you can absolutely go straight into that field. There are great residencies for nurses out there that can train you into what you want to do. So I always knew I wanted to do pediatrics. So my last course in nursing school, similar to a lot of places, is kind of like a capstone where you get to basically work the same schedule as a preceptor nurse. And so I worked on a pediatric unit, really worked to talk to the managers of that unit and try to get them to hire me. And so they did. I was probably pretty persistent. So I worked at Children's Hospital of Austin, which is now Dell Children's, and worked there for 3 or 4 years. I worked pediatric med-surg, and also after about a year went into pediatric critical care. So I'm a PICU nurse by trade. I also worked for 10 years at Driscoll Children's Hospital in Corpus Christi, which is really the cornerstone kind of pediatric hospital for South Texas, and it was my very, very favorite place to work. I love the people there. It's a private entity I mean, it's a nonprofit hospital, but it's not owned by a big corporate giant, and they really take good care of their nurses, and they're just a wonderful facility. And so I would recommend anybody get a job there if pediatric nursing is something you're interested in. So that's kind of my journey. I went back and got my master's degree. As soon as I got my license, I just kept going because I figured if I stopped, I wouldn't get it. And after about 10 years of working bedside, I decided to do part-time teaching and part-time bedside, and I did that for several years. Then I decided to kind of do teaching full-time and bedside nursing part-time just to keep my skills up. And so that's where I am now. And I moved back here to College Station 8 years ago, and went back to school again, got my PhD and graduated with that last year. And so I'm kind of now doing a lot more research in pediatric nursing. That's still my passion, and that's kind of where I am. And I wanted to answer the question about challenges you face during your nursing program. So one big thing, there's no doubt that nursing school is competitive. It's competitive now. It was competitive 20 years ago. So one big thing that I wish someone had told me is that those prerequisites that you take, the English courses, the math, the anatomy and physiology, the biology, those classes that you're taking even now in high school are super important. It will define how well you do on exams like the HESI admission assessment and how well you will do in the college courses, whose grades, you know, determine whether or not you're going to get into nursing school. So that is super important. I also learned that nursing school was much more challenging to me than a lot of the prerequisites were. It's a different way of testing, it's a different way of learning, and I really needed to be accountable for my own learning and not expect my professors to tell me every single thing I needed to know. I had to do reading on my own. We have lecture 2 hours a week, 3 hours a week, and there's no way that your professor can tell you, right, professors? There's no way we can tell you every single thing you need to know. So the accountability is on you, the student, to really read your chapters, as Professor Sullivan said, and really be accountable for your own learning. So those are the challenges that I had that I just wanted to impart.
Thank you, Allison. We appreciate your sharing your knowledge and your experience with us. We do have a question, and if there are any other questions for our A&M nurses, please feel free to put it in the chat. But Yvonne Alan Tavares at La Jolla wants to know, what do you do as a forensic nurse specifically?
We are specially trained to take care of patients or victims of violence, such as domestic violence, child abuse, elder abuse, sexual assault, traumas like stabbings, gunshots. We can also help like in motor vehicle accidents. There are nurse death investigators. There are nurses who are legal consultants, who are forensic nurses. A big part of our job also is testifying in court. So we testify on the patients that we see as far as the history that they gave us and any injuries that we may have seen on them. There's a big variety of different things you can do as a forensic nurse. So it's just, but it's more in the field of victims of violence that we help and treat.
Okay. There's no, are there any diagnostic or research that you would do regarding, let's say, crimes?
There, as far as research, we have someone, Nancy, she's a research in our research, the forensic program. She and Dan, they're doing a study right now, like a bruise study, to see the different stages of bruising, using alternate light sources to see if you can see the bruising after it's gone using a light source. There's some research going on too as far as PTSD after these like sexual assault and domestic violence, and you know, effects of also the emergency contraceptive that we offer in regards to the PTSD. So there's a lot of different researches going on right now.
Thank you for sharing that.
You have to tell them about how they give the bruises.
Oh yeah. So the bruises that they're doing, the bruise study, they put a person behind a shield and open a little area of the arm, and then they shoot them with a with a, oh my God, a paintball gun.
Oh.
So yeah, so we shoot people for our research. Oh, and I did forget to say, as far as education goes, guys, I would say I waited too long, but I'm still going to school. So take advantage now that you're young. I mean, we didn't have in high school what you guys have as far as the advanced learning and taking college courses while you're in high school. But I will be starting my master's this spring, master's in forensic nursing, and I'm going to continue from there. So I think education is very important. I can't stress it enough. Like when I first got out of high school, I was working as a data entry clerk, and I realized that I can't do this the rest of my life. I need a career. I need to go back to school, and that's what prompted me to go back to nursing school.
Thank you for sharing your story. We're so happy to hear all your experiences. Next, we're going to move on to our nurses at Doctors Hospital at Renaissance. I'm going to let them tell you their experiences they have. And I also want to especially thank Ms. Loyola for coming on Some of you students already know who she is if you've had the opportunity to visit DHR for our student workshops. And if you haven't, you'll meet her in the future. So I'll let you give your presentation. Thank you.
Hi, good morning, guys. I'm sure most of you know me from Project HEAL. I'm the instructor here at DHR. I do work clinical. I work in the ICU, so my field is critical care. I've been a nurse for 5 years, and in those 5 years, I've been in the ICU. I was fortunate enough to be able to start in the ICU as a new grad. Majority of the time, they don't hire new grads in the ICU. They'd like you to have experience first. But I worked for them as their tech before graduating, so I was fortunate enough that they were able to hire me. They gave me a couple months of orientation, and then I was on my own. So from there, after the couple of years, now I'm a preceptor myself. So I train the new nurses that do come on. But as an ICU nurse, I do work with the critically ill, those who need closer monitoring as opposed to those patients on the floor. So our ratio is smaller compared to the floor nurses. We can get about 2 to 3 patients depending. At times, if they are really bad, then we would have a 1-to-1. For the most part, I work in a closed unit, so that means that we work closely with certain physicians that medically manage the patient. It's either the intensivist, trauma, or the pediatric intensivist. And from there, they can consult with certain specialties that help with the care of a patient. So for the most part, aside from those medically critically ill, we do work with the trauma patients, like I said. We work with anyone from who gets gunshot wounds, falls, stab wounds, motor vehicle accidents, most patients, I guess, that like Yvonne sees. And from there, but I do work mainly with adults. We do have other nurses who are trained to work with the kids, but majority of the kids that we get in our unit are trauma pediatrics. We also do get patients, neuro patients, so anyone who from stroke, head bleeds, or anything like that. And we do now get patients who need neuroendovascular care. So they don't necessarily need to be opened up in the brain. They can go through certain arteries up to the brain to try and fix certain problems that they get. I am trained in continuous renal replacement therapy. So those are patients that do get dialysis consistently. It's nonstop dialysis until the physician orders it to be stopped. So those usually, when patients are on those, they're really, really sick. So most of the time, those are 1-to-1 care. Aside from taking care of patients like that in the ICU, we also get extra assignments. Extra assignments being we could be rapid response, meaning if they call a rapid up to the floor, that means the patient could be on the verge of crashing. So we go up, assess the patients, and we try to prevent it from becoming a code by either transferring the patient to the ICU or getting the care that they need. But at other times, they do end up becoming a code, and they do come down to the ICU anyways. We have assignments being like code team leader also, so we do respond to other codes that happen. And we can do crash carts, medications, or be a reporter during a code. Also with our patients, we do a lot of different kind of monitoring or assessments. I know I've worked a lot with the kids in regards to basic assessments. But with us, we go further into detail. We have certain machines and numbers that we look at, hemodynamics. And from there, we work closely with the physicians in regards to relaying that information to them. But overall, I chosen the ICU prior to becoming a nurse, and I stayed in the ICU and I'm pretty sure I'll be there for a while longer. So that's my background.
Okay, thank you for sharing that. Students, do you have any questions? Make sure you put them in the chat area, or just come up to the camera and unmute yourself and ask your questions. So now we're going to have another Doctor's Hospital at Renaissance nurse, and she is Miss Margie Rivera. Hi, Margie.
Hi, how are you?
Good morning. We are very excited to hear you share your story. The floor is yours.
Okay, so I started off in the long route getting into nursing. I essentially was kind of a late bloomer. I actually started first as a medical assistant. I had been out of school for a while, and I just kind of fell into nursing. And thank God I did, because I finally found my niche. And so what happened with me was as I wasn't really sure how well I could do in school once I went back to school. So I tried being a medical assistant first to see if I actually could do the job, and I became very fascinated with healthcare. So I decided it was time for me to go back to school and actually become a nurse. And I started off in the emergency room. And my initial plan, believe it or not, was just to spend a year in the emergency room to get the feel for it, get some experience, and maybe try other departments and see where I wanted to land. And 1 year actually turned out to 25 years in the ER. So I kind of just felt so at home with everyone in the emergency room. And I was so fortunate. I was so lucky to have the preceptors that I did. They were fantastic nurses. And I think just the environment suited my personality. Because one of the things that you will find with most ER nurses is that we are type A personalities. We feel like we need to be there to do everything humanly possible to help our patients. And we strive to be perfectionists. And so my work ethic was always that, if they needed me there, regardless of whether I was scheduled to work or not, I was there. And so I really enjoyed my time in the emergency room because it gave me a really broad foundation in critical care. Because you can take care of any type of patient that walks in or gets brought in through the ambulance doors. You can have a geriatric patient, an elderly patient from a nursing home. You can have a newborn. You can have a middle-aged adult. We have trauma patients. We have patients that are very, very ill and have come to the emergency room because they don't have any other means of medical care provided for them. We have those that are winter tourists that come down. And so they basically winter here for 6 to 9 months. And so when they're here, they're not in a position to go see their family physician back home up north. So we get thrown into all sorts of situations and scenarios. So it gives you the opportunity to get trained in a lot of different specialties of critical care. You get exposed to cardiac events. You get exposed to patients who are suffering from pneumonia, from the flu, from a stroke, dialysis patients who are having difficulty with their illnesses, because the population here in South Texas doesn't just suffer from diabetes. It's diabetes, high blood pressure, heart problems, dialysis, you name it. So all of that kind of plays into the actual patient care that we deliver in the emergency room. So with that type of scenario and environment, when you work in that, you not only work with the ER physicians, but you work with surgeons. You work with neurosurgeons. You work with orthopedic doctors. You work with pediatricians. And so you get various amount of multidisciplinary physicians coming in. And so you build those relationships with the physicians and nurses. And it's just a great environment to work in. So I've always explained to students that the ER is the type of area that you're either going to love it and you will thrive, or you'll find out very quickly, oh no, this is not for me. And that's okay, because nursing affords you those opportunities to go and find what area or what department you want to land in. So nursing isn't just, you know, you're either an ICU nurse or you're a tele nurse. You can do just about anything in healthcare when you're a nurse. So I loved my time there, but eventually, after so many years of being in the ER, I decided it was time to get back. So that's when I made the switch over to education, and I pursued my higher degrees. I essentially got my bachelor's, and then I went back and got my master's. So that's what I'm doing now. I'm doing education, and I love it because I love to see the enthusiasm of the new people that are coming into the healthcare field. I love to see the enthusiasm and excitement of finding their way and feeling comfortable with the decision that they've made to go into nursing. So basically, it's been a really fun time for me. I've never looked at it as, you know, oh my God, I have to go to work. I've always looked at it like, you know, today's going to be another day. I wonder what the heck is going to happen, you know, because anything can happen.
Right.
So I've enjoyed myself. I really have. I've been lucky.
Well, good. I'm glad to hear that. I'd like to ask the two of you the same question. What are some of the challenges that you've had to face in the nursing field?
Some of the challenges I think that I had to face when I first started in nursing was, of course, because I did this several years ago. I've been a nurse for such a long time. I think it was just trying to build that confidence in my skills. And that just is something that can't be rushed. It always helps to go back and further your education, because the more you know, the more capable you are of taking care of your patients. So it's a matter of making sure that you stay focused. It's a matter of making sure that all these opportunities and that you have to go back for more education is time well spent. You can never have enough education.
Yeah. Yeah.
Oh, sorry.
Amira?
Go ahead.
I'm so sorry.
So sorry.
It's okay. It's a transition.
No, I do agree. It's that challenge for me, especially when I was new, was finding my confidence. Because yes, I know I wanted ICU, but I always ask myself, am I fit for it? Or am I fit to take care of these patients? Like, am I qualified to take care of these patients? And then you realize it is something you learn, and then you do have to find that you need something to challenge you more and more so that you can get excited about it.
Yes.
I want to give a moment to any of the, I know that if you had noticed, some of the kids transitioned to other classes. So any of the students in the class, if you have a question, please either come up to the computer and unmute and ask it, or put it in the chat. So do we have any questions regarding nursing?
Yes, ma'am. I just wanted to, I guess, kind of clarify on like what are things students, you know, should be doing now in high school to sort of start preparing for nursing, and then of course, again, reemphasize what are some, at least 3 qualities that these professional programs look for in applicants.
That's a great question, Mr. Cantu. Any of the nurses, unmute yourself. They're looking for things that high school students could be doing now, and what are qualities that nursing programs look in high school students.
If you haven't been to a Project HEAL workshop, majority of the time I do tell the students that they need to know their basics. You need to know your fundamentals in order to move on, because nothing will make sense in the nursing program if you don't know your basics. So I told them to focus on their sciences, their A&P especially, so that they can understand the diseases once they start learning it and what they need to do as a nurse in order to help a patient.
I agree. That's some good advice for the students. And of course, we do, when it comes time to get into the School of Nursing, we do look at your GPA on the prerequisite courses. So if you're in concurrent classes with high school and the college, just know that those grades are very important. And so do the best you can when you have that chance, because your GPA will be important on getting into nursing school. And other than that, just a really good high school education, and look and see what kind of clubs you can get in to really expose you to other areas.
Yes, Allison.
Can I speak to, I can tell you the way things are here at Texas A&M, I'm on the committee that assists with admissions and things like that. So we definitely look at GPA, so you need to make good grades. We also look at your HESI score, which we've already discussed, but we also look at other things like your experience volunteering or working. And I didn't have the type of program that you all are in when I was in high school and college, but it's going to make such a difference to you all that you've had this work experience in the programs that you're in. And I would recommend that you use at least some of your free time to volunteer extra time at hospitals, nursing schools, because all of that is logged into our admissions process, and we look at how many hours you have volunteered your time freely and what kind of community service you do. So all that is factored in. And then you also write an essay to get in, and so you want to make sure that your writing skills are well defined and that you have a really good idea of, a lot of times the essays to get into nursing school are asking you why you want to enter this profession and what your passion is about taking care of people. And so having kind of a good personal mission statement on what you want to do with your career, I'd say is also important.
Yes, Ms. John? Oh, wait, we have to unmute.
Oh, okay. Can you hear me now?
Yes.
Yeah, I just want to, let them know that even though like our score, we are not really looking, we are mainly looking into the GPAs and, HESI scores and everything. But I just want to tell them what I see, lately, once they get into the school and then, they drop. After first exam or second exam, they drop, the students. So what I would really, wanted to let them know that, they need perseverance, not that you are a 4.0 student and you just lost, one test and then you are not good for nursing. No, they need to have that kind of strength that, they have to persevere. Make up your mind. If you are for nursing, hey, no matter what, I'm going to do it. That kind of, what do you call it? Making your mind, this is what I want to do in my life, not like,
right.
Know what you are getting into, and if this is what I want to do your best. That is because I am in the committee and I see that we are losing the students and it's going higher and higher, the number, so that's something to the new generation, or the new students. I would like to tell you that. And sometimes when I ask them, okay, what is the reason you want to drop, and they said, well, I didn't know, this is so tough. Hey, this is a profession. It's every professional, education is tough. It is not that, and nursing is the same, nothing different, so just make it that mind. Don't think that nursing is, it's so easy. No, it's not. So be ready for that. That's make yourself this, when you study the materials, Miss, they all said the same thing, anatomy and physiology, critical thinking is also one important part. So be ready for that. When we advise students, they say that, oh, I didn't know that this is going to make a difference, from the school districts when they come from the dual enrollment. So let them know that this is important, so study what you are studying, study for one time, I'm going to get it, that way. Yeah, that's all from me.
Thank you. We also want to know what some of the prerequisites are. And I know that different schools have different prerequisites, and you should go to their website so that you can see those. But if you can share just some of the courses that students should expect to take as prerequisites, please. Anyone? Just a moment. Well, or unmute yourself, or I'll unmute you.
Anatomy and physiology. They'll be required for anatomy and physiology, chemistry and chemistry lab. There'll be English. And there is a statistics, math statistics. There'll be some social science classes that are considered electives. So it might be some ethics classes and things like that. What else, guys? And look at the websites. They're all laid out.
Yes, you should really go to each individual school websites because every school has different prerequisites. Some courses are in groups and you pick a class out of that group, that's fine, but some of them are specific. So it's very important that you go to that school's website. Do we have any other questions? I want to give the classes a last chance. I see Ms. Elizondo. Is somebody at the computer to ask a question? Or Mr. Cantu, Ms. Zambranos? No? No more questions? Well, I want to thank all of our nurses for joining us. I think this has been very informative. We want to thank you for taking time out of your day to ask questions. And I also want to thank you students for participating and joining us today. We will have another session in December, so we'll see you then. Goodbye, everybody.
Thank you.